So last week we did a lot of pharmacology, and this year we'll be continue with the same speed. All right. So we have some drugs lined up, about 50 drugs. All right. So the first one we'll be starting this is diltiazem. So we'll be starting with the pharmacology of what diltiazem. All right. Pharmacology of diltiazem. All right. So in talking about this drug, we'll be going systematically. We'll be talking about the definition, the mechanism of action, the pharmacokinetics, the clinical uses, the safety and side effects when you are using what? A diltiazem drug. All right. So for the definition, we said that this diltiazem is a non-dihydropyridine calcium channel blocker. All right. It's a non-dihydropyridine calcium channel blocker. All right. So it's used to treat conditions such as what? Hypertension, angina pectoris, certain arrhythmias, right? So now looking at the mechanism of action of diltiazem, that's where you get to appreciate the whole drug. All right. So this diltiazem actually works by what? Blocking calcium channels, all right, in the heart or in the blood vessels. Okay. So this inhibits calcium influx into cells. So if you block the channel, calcium will not be able to what? Go into the channels. You get? All right. And when calcium is in the channels, it causes all those what? Contraction, like it will cause the heart or the cells or the heart to now contract and all of that. You get? But when this calcium cannot be able to go in there, then the opposite of the actions will happen. All right. So you see things like what? Vasodilation, and the heart will not be contracting, so there will be reduced what? Heartbeat or heart rate. Okay. So it has intermediate specificity, affecting both cardiac and vascular smooth muscles. Right. So what is the pharmacokinetics of this diltiazem? So for absorption, diltiazem is well absorbed orally, right, with peak serum levels within 1 to 2 hours. Right. Metabolism, it undergoes extensive first pass effect and is metabolized in the liver via cytochrome 3A4 action. Excretion, the drug is excreted primarily through urine, about 60 to 70%. All right. And through feces is about 20 to 25%. Okay. Then its half life is about 3 to 4.5 hours. All right. Then protein binding. This diltiazem is highly what? Protein bound. So about 98% of the drug is bound to plasma proteins. Okay. Now, what is the clinical use of the drug? We have already spoken about it under the mechanism of action and definition, but let's just have it again. Clinical use is used for treating hypertension. So it's used to manage what? Mild to moderate essential hypertension. For angina pectoris, is effective in treating chronic stable angina. For arrhythmias, it's used to treat certain types of what? Arrhythmias such as what? Atrial fibrillation and atrial flutter. Okay. Then off-label use is used for conditions like what? Hyperthyroidism, migraine prophylaxis, and pulmonary hypertension. Alright. What is the safety and side effects of using this drug? Common side effects include, if it is treating hypertension, it is reducing heart rate. So if it is not being monitored, it can now throw the person into what? A state of very low heart rate, which is what? Hypotension. Okay. So it can cause headache, can cause dizziness, can cause peripheral edema. Contraindication, you shouldn't use it in people who have what? Severe aortic stenosis, or people who are hypersensitive to this diltiazem, or any component of its formulation. Okay. Precautions, when you are giving the drug, you monitor for potential what? Interactions with other medications that could be metabolized by what? Cytochrome 3A4. Right. So this diltiazem is a versatile medication that offers benefits in managing cardiovascular conditions by relaxing blood vessels and reducing what? The heart workload. Okay. So that's it for the pharmacology of what? Diltiazem drug.